My name is Warren Lee. I am a critical care doctor, ICU physician at St. Michael's Hospital, and I'm a staff scientist at the Keenan Research Center. As an ICU doctor, I look after a lot of patients with lung failure, lung injury, and that's often from a pneumonia, whether it's from COVID or from influenza. And the realization that we had was that these patients who died from lung injury, they weren't dying because the virus was replicating, they were dying because of the host response. The body's response to the virus was damaging the lungs themselves. And so we had the idea of using zebrafish. Zebrafish are convenient to use because they're very small. They're very inexpensive to work with, and they're vertebrate organisms like humans, so there are some similarities. And as I mentioned, they're an intact organism, so they have all of the immune system and organ systems that allow us to look for drugs that work by enhancing our own body systems instead of just attacking the virus. There are a lot of parallels with pandemic COVID. COVID kills patients by causing lung injury, by damaging the lungs, just like pandemic flu does. And so our research is directly applicable. We started this before COVID, thinking that something like COVID would happen. I didn't know the name, right? But I knew that that a viral pandemic was coming. And so once the COVID pandemic started, it was a natural, not even a pivot, because they're so closely related, to work on preclinical models of coronavirus and to do collaborations with people to see if we could affect COVID-19 lung injury. Some of the discoveries that have been made during COVID have reinforced the validity of our approach. So we know that we're on the right track. One of the advantages at St. Mike's is that we have a fully developed robot-controlled zebrafish facility for drug discovery. I think that's a real asset for the institution. The line of research that we're investigating is trying to develop therapies for lung injury. In this case, from coronavirus or from flu, but it would apply to other causes of lung injury as well. So I'm lucky, I think, that my research is informed by my clinical work, and I hope that my research will inform my clinical work at the end of the day. I do know that when I was in high school and university that I wanted to be a scientist as well, because I was always curious. I was always the kid who asked annoying questions and wanted to know why. And I happened to luck out and have the best job because I get to do both. My curiosity and the need to know things, I think, is a big driver for me. But I also discovered that I really I get a kick out of helping people, using knowledge, using deductive reasoning to try to figure out what is making this patient sick and try to help them and their family. We live in an era of immediacy, right? Immediate gratification, and there's not a lot of patience, I would say, for discovery. And yet I think what the pandemic has made clear is that discovery takes time and is invaluable. Who knows what we discovered today, what use it might have, what life-saving use it might have in 20 years. So to me, that's a really important message. The Angel's Den experience was unique, and there's a whole gamut of emotions. I would say that at first it's a bit terrifying. Stepping out onto the stage at Kerner Hall and all those lights and the packed crowd was very intimidating. But it then changed into exciting. I enjoyed that, and I could feel the crowd's energy, and I could tell that what we were saying was resonating. And then winning was fantastic. It was a great feeling, actually, being able to persuade people of how important the science was. The idea that we were proposing of infecting larval zebrafish with human flu and then screening compounds, libraries of compounds for a novel drug, seemed very logical to me, but not so much to some of the reviewers, let's say, at traditional grant panels. They thought it was a bit too risky. And so it can be very difficult to get grant funding for truly novel ideas. So I would say that without the Angel's Den seed money, the project would never have gotten off the ground. I think there's always going to be a need for things like Angel's Den that are willing to take a chance on a really good idea, because I don't think traditional grantee agencies can always do that. This research would not have happened without the generous donors at Angel's Den. And I am very grateful for being willing to take a chance on my idea and on my lab and on my personnel. And I'm committed to paying back that faith and coming up with something that will improve outcomes for people with lung injury.